what we're fixing to show you is not our one and only way of doing it. This is just some of the ways we've came up with moving patients. What happens, our department has always used hose dummies, rescue Randy's big, 150 normal adult size victims. We made some smaller hose dummies that when we noticed when our firefighters would find them, the first thing they would do was scoop them up and walk out with them or run out with them or whatever. But we go so much detail into how to drag adults to keep their airways low, all this, but when we come across a light dummy or victim, we're not sure what to do because we're not trained on it. We don't have a technique in mind. So the first thing people do is just their gut reactions to scoop them up like you would your child and go. What we're doing today is not, like I said, meant to be the one way to do it all. Hopefully it starts a discussion on how we move smaller patients. This is something that we're going to show a technique or two, and hopefully it'll get some discussion going, and people will come up with better ways than this, because I'm sure there's a lot of different ways we could improve on this. Okay, this is to simulate 4, 5, 6-year-old kid. A kid, his hands are presenting to us first. What we're going to do is take his wrist and put it in our hand. This is going to keep the patient low, and then we're going to just crawl out. In this scenario, we came across the victim feet first. We'll use the same basic technique, ankles in hand. On a bigger child, you might not be able to get both of your ankles in your hand, but as with the first techniques, this helps keep the airway low and in the best air possible. This one is for a smaller child, something that you can easily pick up and hold to your chest. What you'll want to do is cradle the head. Head up, head down, doesn't matter. And you'll want to pick the child up, and then you'll crawl out. This also helps keep the head there.
Let's roll him over. Hold on. I gotta get him rolled over.
Searching a child's room and you come to the bed patting, the covers you can miss a lot because there's so much stuff. My son sleeps with blankets and stuffed animals and so much stuff that you can miss a kid. What we like to do is grab everything on the bed, drag it off in our lap. If there's a 30, 40-pound kid in there, you'll feel it. Take everything in the bundle that you have in your lap, wrap it up in your arms, and go out with it. Look. Big. Hey, we got bed here too. Go ahead back up. Got bed. Big. How you doing? All right, go. Big more bed. You got a big more bed? Yep. Big sip. All right, I'm going out. I'm on ground. Ground. Hey, room. Hey, big. Hey, bump that. Get this.